With over 61 names, added to over 80% of foods in supermarkets, 82 grams of this addictive substance is consumed on average per day. Naturally, it causes dental problems, type 2 diabetes, heart disease, and obesity. If created synthetically, researchers have linked its consumption to Parkinson's, Alzheimer's, and additional neurological conditions. 1 of every 3 kids in America are affected by obesity, but it's not necessarily their fault. The ever-growing amount of sugar in foods causes most of these overweight patients and is directly caused by the corruption found in the food industry and lack of laws involving food production and products. Let's start from the beginning, the very beginning. When the sugar in foods began to rise, the obesity and health-related problems followed. Scientists from Harvard researched this growing issue and concluded that sugar was the killer. To hush the Harvard scientists, the Sugar Research Foundation, now known as the Sugar Association, paid them $50,000 to release a review linking heart disease and obesity to fat content. Reports came out about Coca-Cola funding scientists to shift focus away from a bad diet and promoting exercise to control weight, despite exercising having little impact on weight. Food and beverages have more impact on weight. The Global Energy Balance Network claims people are too fixed on consumption and not enough attention to exercise. The bottom line is Coca-Cola funding scientists to promote more exercise when the real problem is hiding in our food. What the consumer buys, the companies provide. So companies across the nation replaced fat with sugar and stamped diet, low fat, and reduced fat all over their labels.
And so we were remanded as a country to reduce our consumption of fat from 40% to 30%. Well, guess what? We did it. We are there. But the total consumption of calories, and specifically carbohydrate, and especially sugar, has gone through the roof.
We asked a mom whether she looks on food labels when she purchases food and what she looks for.
Depending on the product, I would do more dairy. I read the labels more. Not so much on canned items.
The USDA created dietary guidelines to restrict fat intake, and members of the advisory were found with financial ties to candy bar companies, Coca-Cola, and the McDonald's Council. The American Academy of Family Physicians created a relationship with Coca-Cola to promote healthy eating, and before that had ties to Philip Morris, a cigarette maker.
What you're doing, very similar to what the tobacco companies did when, after the link with cancer had been established, started then trying to get us all to smoke light cigarettes, as opposed to saying, don't have any of them.
As scary as this all sounds, what effect is it having on us? The average American consumes about 26 teaspoons of sugar each day, adding up to about 40 kilos of sugar each year. Obesity-related diseases includes arthritis, cancer, liver disease, heart attacks, and stroke, some of which are leading causes of preventable death. Nearly 69% of U.S. adults are overweight or obese, all thanks to the corruption in the food industry. On average, the medical costs for people who have obesity or other obesity-related problems were $1,429 higher than those of normal weight. Companies are pointing fingers at the consumer, claiming the population weight gain is from our choices and lifestyle. While those do play a role in this epidemic, exercise accounts for only 20% of weight control. Huge industries are dictating our health and causing illnesses and sicknesses within our community, and not only are we unaware of it, but we have little power to stop it. In 1990, Congress passed the Nutrition Labeling and Education Act, giving the FDA authority to require nutrition labeling on food packaging. The FDA determined that sugar did not need to be included. Eventually, after extensive comments questioning this decision, the final regulations included a total, but not added, sugar disclosure requirement. The FDA also allowed manufacturers to claim their food as healthy based on levels of fat, cholesterol, and sodium, but not sugar. Over time, the agency rejected public health concerns about added sugar due to lack of evidence. In 2008 to 2009, the total population's intake of added sugar is significantly higher than it was when the FDA made its initial determinations regarding sugar, making the current laws outdated for our society. In 2009, the American Heart Association released a statement reviewing the evidence, concluding weight gain is related to the increase in added sugar. So, how can we stop this? Educate. While more and more people every day are realizing the crisis we are in, more people are making changes. In a poll done with high school students, 60% of students thought sugar was worse than fat. And while that's better than it's been in previous studies, that number has room for improvement. Being aware of what you're putting in your body is just as important as knowing what your dollar is supporting. The common rumor that all healthy food is more expensive only holds true to some of the product categories, not all. The food industry is tied to the government, therefore heavily protected. But without the people, these businesses will lack funds. So even though you might be too young to start voting, your dollar is your vote. What you buy or don't buy will affect the company's profit, determining which stay in business and which don't. It is expected that another upgrade to food labeling regulations will take place July of 2018, but we can't stop there. Our current situation must be addressed soon because the government is financially tied to the food industry and dictates our food. It's causing more people to die each year from obesity-related problems and cancer, and there's nothing stopping the food industry from incorrectly advertising their products. Push the FDA for better laws about food labeling and packaging and uncover the secrets about what's really hiding in our food.
I like to be healthy because I want to be big and strong.